Hello, my name is Madison Knipp. I'm an 8th semester nursing student, and today I'm going to be performing suctioning on my patient's trach. Before I begin, I'd make sure that I have the suction turned to 80 and 120. I would make sure that my patient is hyperoxygenated. I would do an assessment. I would check his lung sounds. I check his heart sounds. I would check his oxygen level, do a complete set of vital signs. I'd make sure that my patient is in semi-Fowler position, and I'd make sure that there is an extra trach and obturator at the bedside just in case anything went wrong. I'd also make sure that my patient has some type of communication with me, such as raising his left hand if anything were to go wrong. Knock, knock, Mr. Jones. My name is Madison, and I'm going to be your student nurse today. Today I'm going to be performing suctioning on your trach. Is that okay? Perfect. Okay, so I'm just going to remove this here. Can you tell me your name and your date of birth? Very good, thank you. And I'm going to make sure that I have provided privacy before beginning. Before I begin, I'm also going to, like I said, I've already set the suctioning to between 80 and 120. And I'm going to test to make sure that the suctioning is working good, and it is. And then before, this has already been opened and used, so before beginning, I'm going to make sure to lip it. I need to open my sterile field, making sure to be mindful of all margins when doing so. On my sterile gloves. Okay, I'm going to remove and when doing suction, I'm going to make sure to do intermittent suctioning for 10 to 15 seconds. When going down, I would stop the suctioning when either it meets resistance or my patient begins to cough. Okay, so now I'm going to, my left hand is now going to become my dirty hand while my right hand is my sterile hand. Okay, I'm going to remove the oxygen. As I said earlier, my patient is hyperoxygenated. I'm going to pick this up. This hand has now become dirty. And I'm going to test to make sure that I cleanse my suction before beginning. And when doing this, like I said, I'm going to go down until I meet resistance or until my patient coughs. Again, Mr. Jones, if anything, if you cannot tolerate this, make sure to raise your left hand, okay? So I'm going to go down. I have met resistance, and I'm going to do intermittent suctioning. 10 to 15 seconds out. Making sure to clean it out, giving my patient at least 30 seconds to a minute to breathe. I'm gonna go again until my patient either coughs or I meet resistance. met resistance. I'm going to do intermittent sectioning again for no longer than 10 to 15 seconds. Okay, and at this time, there are no more secretions. I am now going to remove this. When I'm finished, I'm going to make sure that I document how well my patient tolerated this sectioning. I'm going to make sure to document if the patient has any secretions, the characteristics, the color. I'm going to document his respirations after sectioning. Again, his breathing sounds. I'm going to turn the section back to normal settings, and I'm going to turn his oxygen also down to normal settings. Mr. Jones, you did a great job.